one thing that's coming up a lot about, and I know that you and I share the same opinion on this. So there's a lot of buzz, I'd like to say buzz, about the liquid rhinoplasty coming up. I mean, I probably get at least 4 or 5 people call a day saying, hey, can't you just stick a little something in my nose? So my usual things that I normally say are, your nose is extremely special. We know that where it is, the blood supply, the tissue layers, and all these various things are extremely sensitive. And you don't just willy-nilly stick something in there because it does have ramifications. There have been cases of people going blind. There's cases of scar tissue. And if down the road you really do want a rhinoplasty, it's going to make that job 5 or 10 times more difficult. It's actually a revision rhinoplasty at that time. So what's your take on the liquid rhinoplasty?
Well, I think that it is a situation that patients misunderstand that what a liquid, quotes, I use the word liquid rhinoplasty, really is, in the sense that they feel that you can do the same thing by injecting some of these cosmetic fillers that you can performing a surgical rhinoplasty, which is the real negative part of what happens when you see advertising on a procedure like that. This liquid rhinoplasty that people do mention are done in a very special type of a deformity that, number one, is temporary, and number two, only gives an impression of a change.
Correct.
It's a change, but it's not the overall picture. When you change, as you mentioned, this device that you talked about measuring projection, which is how far the nose sticks out, or the length of the nose with how short it is, or the width of the nose, and so forth. All of those things are things that have to be considered when you're doing a surgical rhinoplasty. Doing a filler, you're really experiencing a very small dimension, and it is something that I do feel, just from what I have seen, is more of an advertising ploy than a real procedure. And I think patients have to be very careful because, number one, the fillers are very expensive. They last a very short period of time, and the satisfaction is just not there. And I think the patients just need to be really educated as to what it really is.
Yeah, I agree. I think that fillers do have a role. I do sometimes use fillers. For example, if I've done an extremely complicated revision rhinoplasty and a patient has a very minimal deformity, which is almost imperceptible but can be shadowed with a tad bit of filler, I think that's a great use of a filler.
But that's different than a rhinoplasty.
Exactly. Exactly. I
That's
agree.
what you're saying there. That's where the finesse
Right.
of a good rhinoplastic surgeon can come in, when the choice of a specific filler to take care of a very minute little defect that can make the patient very happy. That's a total different ballgame. You're not
Right.
changing a whole.
Absolutely agree. And I think that it's a conversation I have with my patient, and I say, listen, you know, I believe that doing a small amount of filler may help with this, and the risk benefit ratio is in your benefit, because I really don't want to open everything up again, because I don't think that the risk benefit ratio to doing that is in your favor. So I think that that's why I say fillers, I think, have a role in these little things. I'm not saying it's off the table completely, but I do believe that it's not a rhinoplasty.
That's the key. That's the key.